Um, Alcohol is not good for you. It's a curious drug in many ways. In terms of the amount of alcohol you need to get you intoxicated, it's a very weak drug. It takes several ounces of alcohol to get you intoxicated. Several ounces of LSD will get the whole of Edmonton stoned. So it's got some rather unusual sorts of properties. The good news about alcohol is that you can use it for quite long periods of time, and although you create some damage to the liver and the stomach, the effects are reversible. In other words, you stop drinking and your liver recovers. That's the good news. The problem, however, is that if you do it for too long, what happens is you stop drinking and your liver does not recover. And you have this condition called end-stage renal disease, which is inevitably fatal unless you get a liver transplant, which is not a lightweight operation. So with alcohol, the bottom line is that the sooner you develop the courage to quit, the better. And if you do quit, then your chances of making a complete recovery are actually very good. I think that that's the key point. I mean, again, I should stress that you can't take an alcoholic and tell them all about diseased livers and expect them to stop drinking. It doesn't have that immediate impact on them. But there really are genuine health problems with chronic alcoholics. They have weak hearts, so they tend to have heart attacks more often. They tend to have muscle wasting, so they're not strong physically as well. And the stomach tends to get affected, so you chew a lot of antacids, get stomach aches. And the liver is responsible for getting rid of the alcohol, and that gets damaged quite easily as well. You also get feminization, incidentally, of males. Men tend to lose their sex drive and tend to have a more female pattern of body fat and body hair when they're in late alcoholism. So it basically is ugly. There's no question about it. The chronic alcoholic, we blame them, but actually they're more to be pitied than blamed.